Joining us is Professor Johan Giesecke, one of the world's most senior epidemiologists. He's an advisor to the Swedish government. Indeed, he was Sweden's chief epidemiologist, and he appointed the current bloke who's doing the job. He was also the first, as Rita said, chief scientist of the European Centre for Disease Prevention and Control. And I'm delighted he's going to tell us exactly what he thinks with classic Swedish bluntness. Welcome to Outsiders, Professor Johan Giesecke.
Thank you very much.
Great to have you here. So let's kick
nice to be there.
Let's kick it off. You've been a strong critic of the idea of lockdowns. Sweden has avoided the sort of lockdowns that we're seeing here in Australia. Tell us your thoughts. Are lockdowns the correct way to go?
You introduced me by saying that I would say that you got it all wrong. I don't think you got it all wrong, but you painted yourself into a corner, and I'm watching with interest how you and 100 other countries will climb out of the lockdown. Because I don't think any government that I know gave a minute's thought about how they would get out of the different lockdowns that are installed. Take a school closure, for example. If you close the schools, when are you going to open them? What's the criteria? I don't think anyone thought about that when the closure was decided on. Anyway, so Sweden doesn't have such a strict lockdown. There are a few things that are forbidden. The crowd can't be more than 50 people. At restaurants that are mostly open, there should be 5 feet or 1.5 meters between the tables. You have to sit down and eat. There are a few things like that, but rather mild things. And very few laws and ordinances passed. You can go out without being stopped by the police and fined or threatened with prison. And mostly, you talked about trust. I was listening the last 10 minutes of the previous. We trust the people. People are not stupid. That's sort of the basic line on the Swedish. If you tell people what's good for them and what's good for their neighbors and other people, they do that. If you take a restriction that's sensitive sensible and understandable, people will follow it.
Rita.
Now, Johan, you said that you think the results are going to be similar across most countries, regardless of the approach they've taken. Can you take us through that?
Seeing is a tsunami of a rather mild infection spreading around the globe. And I think there's very little chance to stop it by any measure we take. Most people will become infected by this, and most people won't even notice. We have data now from Sweden that shows that between 98 and 99% of the cases have had a very mild infection or didn't even realize they were infected. Wow. So we have this spread of this mild disease around the globe, and most of it is happening where we don't see it. It's among people that don't get very sick, spread it to someone else who doesn't get very sick. And what we're looking at is a thin layer at the top of people who do develop disease, an even thinner layer of people that go into intensive care, and an even thinner layer of people who die. But the real outbreak is happening where we don't see it.
James.
So if I'm taking it correctly, Professor, you're saying that at some point pretty much everybody is going to get this disease to some degree or another. Now, here in Australia, we've done an incredibly good job suppressing it. I'm wondering, do you think we have done too good a job? Is it possible to do too good a job suppressing it in the early stages, such that then you don't ever wind up being able to take the foot off the brake, as it were, on your restrictions, to get the disease just out and a manageable flow of cases that the health system, which we were told this was all about preparing for, that can then be allowed to handle cases as they come through?
Yes, I mean, that is one point, to flatten the curve a bit so that healthcare isn't overused or anyway. But you make it succeed, and New Zealand may also succeed. But I've been asking myself, when New Zealand or Australia has stamped out every case in the country, what do you do for the next 30 years? Will you close your borders completely, quarantine for everyone who's going to Australia or New Zealand? Because the disease will be out there. I don't know how you're going to handle that, but that's your problem. Yes.
Sorry, you've said that you think that as in most countries, regardless of the measures we take. So, for example, Taiwan has been very successful. Other countries like Italy have been disaster cases. But you think that at the end of the day, they're all pretty much going to end up with the same fatalities, the same results, the same deaths, regardless of what measures they took. Explain that.
Basically, I think that's the same. Because, like I said, the real epidemic is invisible, and it's going on all the time around us. The other thing with the lockdown is when you open it, you will have more cases. So the countries who pride themselves in having few deaths now will get these deaths when they start lifting the lockdown.
Tell us briefly about the Imperial College results that sparked this worldwide panic. You believe they were flawed. These were the initial results that were coming out and the modelling that was saying, oh, millions are going to die. Here it was 150,000 are going to die. You thought that was flawed. Tell us why.
Yes, there are a few procedural things that are boring. One is the paper was never published, which is normal scientific behavior. The second thing, it wasn't peer-reviewed. That means looked upon by other people, which is also normal scientific procedure. So it was more like an internal departmental communication, a memo. And then the big mistake that the Imperial Group was underestimating the number or the proportion of the very mild cases that would never be detected. That's the main thing with that prediction. And it's fascinating how it changed the policy of the world. I mean, the United Kingdom made a U-turn overnight after the publication of the paper, which is fascinating in a way. So yes, there are several other mistakes with the paper, but that gets very technical if you get into that.
Rita.
Now, you mentioned that the overwhelming majority of people who get this disease have no symptoms or very minimal symptoms. Do we even know the real fatality rate of coronavirus? And what is it?
Well, it's around 0.1%.
We were told it was 3% initially, 2%. Are you saying now if it's 0.1, that's pretty much the same fatality rate as the regular flu, isn't it?
I think it's a bit higher, actually. I had said before in Sweden that this is like a severe influenza. I don't think that's completely true. It will be a bit more severe than influenza, but not maybe double, but not tenfold.
Okay.
James?
I just want to ask, with all of the healthcare systems then focusing on flattening the curve and being prepared for these waves of infection, which aren't necessarily coming because of the very restrictive measures, overall, are we going to see more people dying from, we talked a little bit about this before on the show, of cancers, heart attacks, things like that, simply because they're too scared to go to the hospital because they think they won't get treated? Is there going to be other deaths that are going to be caused by our overweening focus just on this one particular disease?
Could well be. The emergency rooms here in Stockholm have about 50% of the usual number of patients coming in. And one reason is probably that people are scared of contracting the disease when they go into hospital. And another is that they are not, I think they say they can wait a bit till the thing is over.
So,
of course,
Professor,
we still have people who have, sorry, yes?
Sorry, Professor, you've said the best policy, the correct policy would simply be to protect the old and the frail. Is that correct?
Yes, and that's the Swedish. The Swedish model has sort of two pillars. One is only use measures that are evidence-based, and there are two that are evidence-based. And one is washing hands is good. We've known that for 150 years, since Semmelweis in Austria a long time ago. The other is social distancing. If you don't get too close to other people, they won't infect you. And the third may be trust people. People are not stupid. If you tell them what's good for them, they will do what you say. You don't need these soldiers in the street and police, and it's unnecessary.
Fantastic advice. Professor Johan Giesecke from Sweden, thanks so much for staying up so very, very late this evening in Stockholm. Thanks so much for chatting to us, and fantastic advice. Thank you so much.
Thank you very much.